Now, treating patients with different kinds of phobias is again very interesting. Now, you have taken a detailed history of that particular patient, and he had given you the history towards the triggering factor that basically triggers that panic attack, or that basically triggers the anxiety attack in that particular patient. And you have classified the type of phobia that he has, whether it is a claustrophobia, whether he's suffering from agoraphobia, or some special or specific kind of phobias, for example, phobia towards the height or towards the water or towards specific kind of situations, for example, the medical treatments or the dental treatments, etc. Now you will start off with the treatment guidelines. The pharmacotherapy is to be considered, and sometimes counseling is just enough for that particular patient. And sometimes we have to couple these counseling sessions along with the medications or along with the pharmacotherapies that we can consider in that particular patient. The severity of symptoms has to be considered in these individuals in detail over here. The general principles of management that usually we consider, sometimes the symptomatology, the triggering factor has to be kept in mind when we are dealing that particular case. The psychotherapy is considered the treatment of choice in these individuals, and the pharmacotherapy is sometimes coupled with this psychotherapy. The general principles for management: there's a careful assessment with empathy. So empathizing with your patient is again very important to develop that rapport with your patient and to develop that doctor-patient relationship, to get that complete history, to get that detailed history about his childhood, about his relationships, and about his social behaviors that he usually goes through, and what kind of phobia he's suffering from is again very important when you're managing such a patient with phobia. The assessment of the other conditions is again very important. For example, the depression. The treatment is usually of the psychological type, and we are going to also consider the pharmacological treatment, and a combination of both is sometimes suggested in a lot of cases. Now, basically, the psychological treatment that we usually consider in these individuals is again very important over here. CBT, which is basically the cognitive behavioral therapy, that is going to be considered along with the medications if the person or if the patient is not responding to CBT, or he's not responding to the counseling sessions with his psychiatrist, then we'll consider the medications along with this CBT. The behavioral techniques, they're going to be considered in this particular individual, and then exposure to the feared situations. So sometimes repeated exposure to that particular feared situation or a feared object, the person will basically get immune to that situation, and sometimes the people can be treated just by those repeated exposures. So this is one of the techniques that we usually have. Then the use of the imagery is again very important. The gradual exposure is very important. The process of extinction is inculcated, and the relaxation techniques, the person is told to get the deep breaths in those situations if it is of the milder form. And the anxiety management techniques are inculcated: the progressive muscular relaxation and the breathing retraining. So this is the breathing training. You give a breathing training to that person to get control of his panics, or to get control of his anxiety symptoms. And after all of these combination of treatments, the patient will usually give you a history that he basically knows how to control his panic symptoms. And after the repeated exposures towards that situations, or towards that feared objects, he may get control over his panic attacks. The technique of flooding: the form of exposure is real or imagery in these cases, and the rate of exposure is sudden. And then we have the relaxation management is sometimes not inculcated in these individuals. So the graded exposure is sometimes the form of exposure in these patients is real, the rate of exposure is gradual, and the relaxation management is inculcated in this kind of behavioral therapy or the CBT techniques. The systemic desensitization, in which again we inculcate the imagery, and the rate of exposure is quite gradual in these individuals, and the relaxation management is seen in this systemic desensitization, in which there is a gradual exposure to that feared situation or that feared object. Cognitively delivered exposure, in which we have a real or imagined real exposure, and then the rate of exposure is sudden and sometimes gradual, or the relaxation management is inculcated in these CBTs or the cognitive behavioral therapy. So basically, you play with the thoughts of that person, and then you ask that person to change his behavior towards that particular triggering stimuli that he is exposed to in these techniques. The pharmacological treatments, when we consider them, that basically involves the four groups of antidepressants that we usually talk about. It can be the serotonin reuptake inhibitors, that is the SSRIs, or the SNRIs, and then we have the tricyclic antidepressants, the MAO inhibitors, which are also known as the monoamine oxidase inhibitors. So these are the treatment choices that we have whenever we are considering these pharmacological treatments. The drug of choice that lies over here is the SSRIs, that is the serotonin reuptake inhibitors in this case. Then the problems with the initial exacerbation of anxiety is basically, it has to be considered. The adverse effects of these pharmacological treatments are the weight gain and the sexual dysfunction. So when you have developed these adverse effects, you have to treat them as well, and you have to address them as well if the person is suffering from weight gain or the sexual dysfunction. The simple gradual self-exposure is again very important. Talking about the agoraphobia, which is basically fear towards the public imaging or the public speaking, publicly eating, the pharmacological therapy is again, it has to be considered in these cases, and it includes the SSRIs. The medications prove useful in these cases, and if the comorbid depression is present, we have to basically combine the SSRIs with the tricyclic antidepressants in these cases. The psychological therapies, they include the elements of the graded exposure in these cases, and then the systemic desensitization is also considered, in which you basically gradually expose this person towards that triggering stimuli, and then you systemically desensitize that person. The significant cognitive element, what the person is thinking at the time of the panic attack, is again very important, and you have to deal and you have to counsel that patient to get him out of that situation. The social phobias, in which we treat the patient with antidepressants and the pharmacological treatments, are usually given on a longer term basis. The psychological treatment is quite easier in these individuals. Sometimes you just counsel these patients, and usually cognitively based. Progressive muscular relaxation techniques are advised in these cases. Then imagination or the real life exposure is also one of the techniques that is devised. The cognitive reconstruction is important. The social skills training is also considered. And then to interpret the ambiguous information. He'll give you a collection of information, and then you're going to interpret what he is giving you clues towards the triggering factor. The mild social phobias are again very important. They benefit from the beta blockers and they reduce the somatic manifestations. And sometimes there are no effects of the cognitive feelings as well. The use of benzodiazepines are there taken into account as an anxiolytic or the minimal potential for tolerance as well. The psychological treatment with the behavioral methods is taken into account and depends upon the severity of the phobias and the behavioral methods as well. They are effective in the single session, and the cognitive techniques are also implied upon when we are treating those specific phobias towards specific objects as well. So in this section, basically, we dealt with the different pharmacotherapies and the psychological treatment that we can depend upon while treating such patients. So that is the end of this section. Thank you for watching sqadia.com.